Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. Later in our program tonight, how to get the best financial aid deal for college. Towson University's Director of Financial Aid will join us to answer your questions. First tonight, it is open enrollment season for health insurance. Joining us now with tips is Christine Hall, Executive Director of Healthy Howard. Christine, thanks so much for being here.
Thanks. I'm glad to be here, Jeff.
Your group works with a lot of people who are looking, shopping for health insurance. What we're hearing so far is that the newly remade health website is working pretty well. Is that what you hear?
Yes, as you just stated, it is a new and improved system, Maryland Health Connection. .gov, and it's been performing great since open enrollment began on November 15th. Just today, middle of today, we found out that there were more than 20,000 Maryland residents who had successfully enrolled into health coverage. One
of the things that your group does is help people successfully enroll into health coverage. What are some of the challenges? I would imagine that just the complexity of it all, even though it's been simplified, is one of the big ones.
Right, that's right. Healthy Howard, we are one of Maryland Health Connection's 6 connector organizations that is helping residents enroll into quality, affordable health coverage under the Affordable Care Act. And one of the biggest challenges has been, this is the first time for many people who have enrolled into health coverage. So there have been a lot of questions about, what some of the terms mean, such as, deductibles and coinsurance and things like that. But we have our trained and certified staff are there to help provide assistance and answer questions as to what options are available to consumers.
You cover not just Howard County, but a good part of Western Maryland.
Yes, our Door to Healthcare program is the official organization for the Western region, and we are serving Allegheny, Garrett, Carroll, Frederick, Washington, and Howard counties.
So for people watching in those areas who have some questions, what do they do? How can you get, is it in person, is it over the phone?
Well, there are several things that individuals in the Western region can do. They can go to our Door to Healthcare website, which is doortohealthcare.org, or they can call our call center at 1-855-288-3667 and get answers to their questions. They can find out for in-person assistance, such as meeting with a authorized insurance broker or one of our navigators.
How do the insurance brokers fit into the process now? I mean, the website, in a sense, kind of does what they used to do, help people compare.
Well, there are more than 2,000 authorized licensed insurance brokers through Maryland Health Connection, and they're able to give advice to consumers about what is the best insurance plan for them and their families. Our navigators are able to provide assistance that will help enable consumers pick the right plan.
And there are other navigators available in other parts of the state, not just your service area. And somebody might be able to find them, I guess, by going on the main Health Connection website?
That's correct. People outside of the Western region, they can call 1-855-642-8572. That is the state's Consumer Support Center. And they can also go to marylandhealthconnection.gov to see available health plans that are on the website, find out what kind of financial assistance they may qualify for, and to also get more specific details about costs, benefits, and doctors in network.
What are some of the questions that trip people up? Where do they have? I mean, we know it's a complex thing, and you have the different levels of coverage. It could be gold, it could be bronze, and so forth. You have different plans with different networks of doctors. Where do people, in your experience, need help?
I think when they're looking at what kind of financial assistance they can get and the cost of their monthly bill, those are some of the biggest questions that people have. They want to find out, is this affordable? How can I make this affordable for my budget and for my family? So
and to do that, you need to be able to input or tell somebody your financial situation, how much money you make, how large the family is.
Yes.
To see if you qualify for a subsidy.
Yes, that's correct, yes.
Okay. Let's take a phone call. This is Catherine in Howard County. Catherine, thanks for the call. Go ahead.
My concern is, will the insurance be covering abortion and Planned Parenthood? Will we know which insurances are covering that?
Catherine, thanks very much. Do you know offhand?
I would, again, direct Catherine to the MarylandHealthConnection.gov. That's where they can see what available plans are there and get specific details about what's covered in those plans, whatever plan they may be eligible for or choose to enroll in.
What are your thoughts on the idea of comparing networks? We know that Johns Hopkins Hospital has been notifying people that they're not included, their network of hospitals isn't included in some of these plans. And certainly others, I guess, operate as HMOs where your choice of physicians might be a little bit more limited.
Well, we're just really focused on being able to provide individuals with the questions that they may have regarding what options are available to them. Again, we're working very closely with our partners to ensure that we're able to provide that assistance and support that consumers need while they're searching for coverage.
The other thing we haven't talked about is Medicaid and the people who are eligible for that. Do you help with that determination as well?
Yes, we do. Throughout our 40 locations throughout the Western region, we have our trained and certified staff are able to help with enrolling individuals or finding out if people are eligible for Medicaid. Now, Medicaid does not have a set open enrollment period. It is year-round, so that's other information that we're able to share and educate consumers on, that Medicaid enrollment is year-round.
So there's no deadline for that. On the other hand, why wait? And for people who aren't eligible for that and need health insurance, there is a deadline though, and you do have to meet it.
Yes, this deadline for open enrollment this year is February 15th, 2015, and a deadline for those who enrolled last year, they need to be sure that they re-enroll this year by December 18th in order to get the federal subsidies and financial help on their 2015 bill.
And that's coming up pretty soon. So they might assume people who've had insurance through work may have experienced a situation where if you don't do anything, you get the same health insurance next year. So it kind of automatically rolls over, and that's not the case here.
Right. Individuals do have to re-enroll by the December 18th deadline in order to get their federal subsidy applied on their bill for January 2015.
Let's take another call. This is Nick in Carroll County. Nick, thanks for the call. Go ahead.
I have some questions about is insurance going to cover like diabetic supplies like continuous glucose monitors and stuff like that, especially like Medicare?
Okay, thanks very much for the call. And again, you're going to have to look at the plan.
Right, you're going to have to see what the plans cover. Again, I will, encourage individuals to go to the MarylandHealthConnection.gov website. They can find out, the various plans that are available. There are more than 46 medical plans that are available through Maryland, and that including 15 dental plans. So again, the website has a wealth of information that will help educate consumers as to what's available in those plans, what those plans will cover, and the benefits. So they can also they can enroll online, and they can also enroll over the phone.
Let's go out to Baltimore County. This is Lewis. Lewis, thanks for calling. Go ahead.
Yeah, I'd just like to know how you're calling this affordable health care when it's really not affordable. This is crazy. The plan that I could afford, even with assistance, I'd have to pay out $10,000 out of pocket, and and deductibles before I can use that insurance. How is that affordable?
Louis, before you go, is that a high deductible or is that one of the bronze plans?
That is just what my insurance broker through my my doctor's office told me.
Okay, thanks very much. Yeah, I mean, the fact is this stuff's expensive.
Right. There definitely are some plans that, there is a, range of, deductibles and, co-payments that individuals will have to pay. The Affordable Care Act, is the law, and it is, they have definitely been able to, there are some individuals who are able to, pay less based on what the plan they choose. So it is different for some individuals.
But it's important for people who sign up to actually spend some time to drill into the details of what's covered and not covered, because you do hear stories of people who signed up as they were supposed to, and then when they had some medical bills, found out that their deductible was $5,000 or something.
Right. So, our assistants through the Dorda Healthcare staff will help be able to inform and, educate them on, what could be affordable for them.
Very good. Christine Hall is Executive Director of Healthy Howard. Christine, thanks for coming by.
Thank you so much.
Appreciate it. Just ahead tonight, paying for college. Our next guest has the latest strategies for earning college financial aid. We'll be right back.
You've studied hard and made the grade. Is college a dream come true or an expensive nightmare?
Education is for everybody.
Join Mario Armstrong for the ABCs of financial aid.
The earlier you apply, the better your chances are.
Find out what's right for you.
They can use it anywhere at a federally accredited school across the country.
And talk to experts live throughout the show.
Bottom line, you can afford college.
Monday night at 8 on MPT.
Hi, I'm Mark Wahlberg. Watch as Antiques Roadshow discovers Madison is a treasure trove of collectible treats.
In the 19th century, when this was made, this would have been the cat's meow to own.
I know you're shocked, right?
Oh my gosh.
Oh my, wow. That's very unexpected.
Don't miss our visit to Madison, Wisconsin next time on Antiques Roadshow.
Tonight at 9 on MPT.
Next time on Father Brown.
Cyanide poisoning.
A sister from the local convent is murdered.
A willful girl with a streak of rebellion.
But when another nun dies the same way,
there's enough to kill half of Gloucestershire.
Father Brown suspects things aren't as they appear.
But we all have something to hide.
And the nuns prove to be difficult suspects.
With all due respect, Father, you are not the police.
Father Brown.
Tonight at 10 on MPT.
Tonight on MPT2.
PBS presents a tribute to America's king of late-night comedy, Jay Leno. Join Jerry Seinfeld.
There's no one more deserving to get this except maybe me.
Garth Brooks.
Success didn't give him a swelled head. Nature did that.
Jimmy Fallon.
Jay's done so much for NBC that we had to celebrate his career on PBS.
And many more on the Kennedy Center Mark Twain Prize for American Humor.
Tonight at 8 on MPT2.
Joining us now in the studio is David Horn, Director of Financial Aid at Towson University. David, thanks for being with us.
Thank you for having me.
What are the numbers like at Towson in terms of the percentage of students who apply for aid and receive some sort of aid?
I would say off the top of my head, over 70% are receiving some form of aid. Financial aid includes lots of things. It includes need-based grants, it includes merit-based scholarships, it includes student loans, but over 70% are receiving something.
You've been in this field for some time. What are the mistakes that people make that wind up leaving money on the table somehow?
The biggest mistake is just that the process is a multi-step process. There are a couple of forms you can do where you're applying for multiple aid programs at one time, but there isn't one aid application that covers everything. So it's about applying for admission early so that the admissions office considers you for scholarships for admissions. It's about carefully searching every college's website and looking at all the college-specific forms they have. It's about doing the federal form, the FAFSA form, to apply for that aid. It's about searching for scholarships from outside the institution. It's about checking your state resources to look at everything that the state has to offer. And in addition to doing all those things, doing each one of them by the deadline without mistakes.
I don't want to focus on Towson for a second, but
Right.
broadly, when you look at all of the colleges and universities out there, is it fair to say that the merit aid, not need-based, merit goes to kids with the best scores, the best GPA, SATs, relative to the institution they're applying to? So if it's a student they really want to have for academic reasons, that's the kid who's going to get the non-need-based aid, and probably the larger pool of aid is need-based, and you have to fill out the FAFSA and so forth.
The merit-based aid is generally a very competitive process, but merit-based aid kind of includes two things. It's the aid that works as you described it, where it's very much about limited funds going to the top-tier applicants. So, we'll get a lot of calls from, it's hard for parents to not realize that maybe their children are not the absolute top tier, and well, why can't I get a scholarship? And then you give them statistics of, well, this is where our cutoff was this year. This is who was getting the merit aid, and this is where we stopped. But also, sometimes scholarships that are in that merit category are about recruitment and incentives, and about especially with the private schools discounts. There are some schools where everybody gets a scholarship, but a lot of those schools have really big ticket prices. And we always try to remind people, it's not about who gives you the biggest scholarship. It's not about who has the lowest cost. It's what your net cost is, your specific net cost at that school when you look at the school's direct costs and what they're giving you grants and scholarships, non-loan aid. That's the most affordable school for you.
The other bottom line way to look at it is, at the end of hopefully 4 years, or maybe less, what's the value of the degree you're going to walk out the door with compared to any debt you're going to incur? Now, right. There's obviously a lot of controversy about $1 trillion in outstanding student loans nationally. We just hit that milestone recently. It's a lot of money. When's it appropriate for students to take on significant debt?
It's a hard question to decide exactly how much debt is too much and how much debt is the right amount. I think the main things that we try to say, and I can discuss that in a little bit, is when you look at your earnings over the lifetime getting a college degree, you're going to have higher lifetime earnings if you get a college degree. So if you think of taking those student loans as an investment in your education, it's a good investment. Now the question is, what's too much and what's not enough? One of the things we tend to look at is to ideally have your 4-year debt be somewhere near what your starting salary is going to be with the job that you expect to hold. So if you're going to be pursuing a career that doesn't have higher incomes, then you need to be much more conscious about not overborrowing. Having worked at public universities and community colleges and the state systems, I think anybody who's considering a big ticket university needs to think about, how is this going to help me in my career goals? Do I have career goals where I'm going to benefit from a degree from a prestigious university, or the field that I'm in, is it matter? Is it going to make a difference? My worst case scenario is to see somebody who's borrowing an extreme amount of debt and going into a low income career. That's not a good formula.
Let's take some phone calls. This is George in Anne Arundel County. George, thank you for the call. Go ahead.
Good evening.
Hi.
I'd like his opinion on whether he thinks that it would be a good idea, chuckle, to have the school that receives the money have some skin in the game, so that if a student that they've approved to receive federal aid or a federally guaranteed loan, that if the student defaults, then the school that received the money would need to repay that instead of having the taxpayers pay it.
Interesting. Thank you very much.
There's a lot of discussions going on about financial aid. That's one that I've heard, one that I don't know how much thought I've given to. A lot of the things that we all look at is, how much, as a state university, how much funding are we getting from the state? How much funding are we self-supporting through tuition and fee dollars? I think anytime you talk about an idea like that, some of those ideas, it's like, well, how does the transition work? I know there are some states that have looked at programs like that where students were going to pay back their loans based on their income, but to start a system like that, you're not going to start getting any money coming back till the freshman class has graduated and got jobs. So what do you do with the 4-year window? So accountability is relevant, but I think initially at this stage, there's probably other ways to go about looking at data and measuring that rather than going directly to financial pain.
Talk, if you would, broadly about loans, the difference between subsidized and unsubsidized, and just how it all works.
So there are a variety of federal loan programs. We can talk about those, and there's also some private loan programs. So pretty much everybody can borrow some sort of student loan as long as you meet the citizenship standards for federal aid, which is you're a citizen, a permanent resident, or a variety of special citizenship status that are similar to permanent resident. So if you meet those federal citizenship standards, you can get some kind of federal student loan. And the subsidized student loan is for students who can demonstrate financial need. And so that's a means-tested loan. And that loan is interest-free while you're in school and several months after you graduate, 6 months after you graduate. There's also a Perkins loan, but many schools don't have a whole lot of Perkins loans to loan out because there's a limited federal amount of Perkins loans dollars going around. Then there's the unsubsidized loans, which don't require financial needs. So even if your income is very high, you can borrow an unsubsidized student loan. Then there's a federal parent loan, which has a credit check but is not need-based. So you don't have to have high income to borrow a parent loan. It's not need-based. And then in addition to those federal loan programs, there are private student loans. So when you're looking at those things, it's a matter of comparing the interest rates and the financing costs, as well as looking at some of the provisions in the federal loan programs that in some ways can outweigh the interest cost. There's income-based repayment that you can sign up for. If you borrow too many student loans, or even if you don't, you can sign up for income-based repayment where the amount that you pay is based on what you're earning. There's provisions for getting the loans forgiven. Those provisions don't exist for private student loans. So.
And there's no bankruptcy. The deal is if somebody runs into trouble, one of the debts that can't be discharged in bankruptcy is student debt.
Correct.
All right. The FAFSA form, otherwise known as the dreaded FAFSA form that you have to fill out to qualify for certainly any of the subsidized stuff. Any tips for that? I mean, it scares people because it's on par with doing your taxes, I think.
Maybe, but I don't think it's as bad. It is a form that requires you to pay attention. It is a form that requires you to carefully read instructions. But some of the tips are, one of the things that I see trips up people the most, things that we think are simple, we say, go to line 1040 of your tax return and grab the number on line 30 and plug that in. Well, then they open these papers from their tax accountant and they got 50 pages in this folder and they don't know what the 1040 is. Federal tax returns consist of a 1040-EZ, which is a one-page form, or a 1040 or 1040-A, which is a two-page form. That's the form you need to find in that pile of tax debt.
That's the only one you need when you go to fill out the
right. None of the schedules or any other things do you need. So it's designed to be like paint by numbers. This is the FAFSA will say, for this question, go to line 30 of your tax return, grab the number, put it in. Just do that. Don't overthink it. Don't question it. You'll get into more trouble that way.
Are there any scams out there that people should be aware of in terms of offers that will get you a scholarship?
We generally say any time you see a scholarship application that requires you to pay a fee to apply, it's a scam. All that information is available for free from a variety of websites. One of the most popular ones is fastweb.com. They provide very good information about scholarships in an efficient way. They're going to advertise to you extensively as you're on their website, but an informed consumer can choose what ads they want to ignore and choose what ads they want to pay attention to.
And this is not what you do every day, but in terms of people saving for college, if they could do something different at an earlier age so that when they get to your desk they're in better shape, what would it be?
Obviously saving for college. We deal with a lot of families who haven't saved for college and are counting on big fat scholarship to cover everything, and many of those families end up with that parent loan we talked about earlier, basically financing for college rather than saving for college.
Very good. David Horn of Towson University, thanks for your time.
Thank you.
We appreciate it. We are back Thursday at this time with Your Money and Business, with a look at what Black Friday will mean for the economy. Coming up next on MPT, a special program, You Can Afford College. Stay tuned for that, and have a good night.
This program was made by MPT to serve all of our diverse communities.
Switching over everything to the show now.
Okay.